Welcome to the explainer. We hear it all the time. There's an app for that, for, well, everything. But what happens when a really well-designed health app, something built in a clean research lab, gets thrown into the real world? The messy, unpredictable world we all live in? Well, today we're going to dig into a study that pulls back the curtain on the very human side of digital health.
So this is the big promise, right? The idea that we can use technology to fight huge health challenges, like preventing HIV. I mean, it sounds simple, it sounds powerful, and it's super appealing. But you gotta ask, can a piece of software, an app on your phone, really move the needle when it comes up against all the complexities of real human behavior? Well, let's find out.
Okay, so the official term for this stuff is a digital health intervention, or DHI for short. The whole point is to put health promotion and disease prevention tools right on your phone. And that's a really powerful concept, isn't it? Meeting people exactly where they are, literally in the palm of their hand. All right, let's get into the specifics. The app we're talking about today is called Keep It Up, or KIU for short. And this wasn't just some app cooked up in a vacuum. It was designed with and for young men who have sex with men to give them the tools and the knowledge to help them stay HIV negative. And this app is more than just a pamphlet you read once. No, it's a whole journey. Users go through these three main modules: learning about prevention, how to negotiate risk, that kind of thing. But here's the really smart part. There are 2 booster sessions, one at 3 weeks and another at 6 weeks, to make sure all that new info and those new skills actually stick. Okay, so this is where it gets really interesting. An app like Q can look amazing in a controlled study, right? It can tick all the boxes. But the real test, the acid test, is what happens when you take it out of the lab and drop it into the messy, unpredictable real world. And that's exactly what this study did. Researchers followed 22 different community-based organizations, we'll call them CBOs, as they tried to roll out the KIU app. And this was no simulation. We're talking real clients, real staff, and all the real-world headaches and challenges you can imagine. So the very first roadblock they hit was a big one, but it sounds so simple. How do you get people to actually sign up in the first place? You'd think it'd be easy, but it turns out it's a huge puzzle. And the numbers here tell a fascinating story. Get this, a whopping 95% of these CBOs just stuck with what they knew: traditional outreach and partnerships. What's kind of shocking, though, is that only about 27% of them even tried using hookup apps to recruit people. The very digital spaces where their target audience is most active. Right away, you see this huge disconnect between old school habits and a new school tool. And this quote, wow, it just says it all. It's not just what you're pitching, it's where you're pitching it. Trying to sign people up in a public lobby? Yeah, that didn't go over well. It immediately raised privacy flags about their LGBT status. It's a powerful reminder that the physical space, the context, is absolutely critical. You have to build trust before you can even start the conversation. They also figured out pretty fast that the words they used mattered a lot. That jargon-filled pitch, "This is the KIU, DHI," it just fell flat. The approach that actually worked was framing the app as something that supports what clients were already doing for their health. It wasn't about telling them what to do, it was about giving them a tool to help them on their own journey. It's empowerment, not a prescription. And it wasn't just about the pitch itself, the whole process had to change. And you know what one of the most effective changes was? Something so simple. One CBO just put a sticker on their intake forms as a reminder for the staff. That's it. These tiny little tweaks to their existing workflow made a massive difference in making sure the right people were actually offered the app.
All right, so let's say you get someone to sign up. Awesome, but that's really only half the battle. The next huge struggle was retention. Once someone's in, how do you keep them engaged? How do you make sure they actually stick with it and finish the whole program?
And believe me, these organizations tried just about everything. Phone calls, text messages, emails, you name it. But here's the kicker. Despite throwing the kitchen sink at the problem, the study found there was no magic bullet. There was no single method that everyone agreed worked for keeping users engaged. This next part really shows you the disconnect that can happen. One CBO had this great idea, right? They hosted in-person events, even had raffles to try and boost engagement. But get this, some of the participants were actually annoyed. They signed up for a digital, private experience. They didn't want to go to a meetup. It's just a perfect example of how even a really well-meaning idea can totally miss the mark if it doesn't match what the users actually expect.
So what does all this add up to? Well, it points to a really crucial lesson. Building a fantastic, scientifically proven app, that's just step one. The tech itself, no matter how slick or well-designed it is just not enough to make it work in the real world. What the study really drives home is that success comes down to the human stuff. Things like making the pitch personal, weaving the app into the daily workflow so it's not a hassle, and having dedicated staff who are actually excited about it. And think about it, something as simple as staff turnover could completely sink the whole effort. The big takeaway here is that the human infrastructure you build around the tech is every bit as important as the digital code itself.
And all of this leaves us with a pretty big question for the future of digital health, doesn't it? The finish line can't just be about launching the next cool app. The real challenge, the real work is this. Are we putting just as much energy and investment into the people, the training, and the real-world processes that connect that technology to the communities it's supposed to help? Because this study makes it pretty clear. That's where the real work begins.